Today there are 2 new cases of COVID-19 to report in managed isolation facilities in New Zealand. It's been 70 days since the last case of COVID-19 that was acquired locally from an unknown source in the community. The first case is a man in his 20s who arrived in New Zealand on the 28th of June from India. He has been at the Sudima Auckland Airport facility since his arrival. He tested negative on day 3 of his stay, but subsequently tested positive on his test around day 12. The second case is a man in his 20s who arrived in New Zealand on the 27th of June from England. He's been in managed isolation at the Sudima Lake Resort in Rotorua. He tested positive on the 9th of July on the day 12 of his stay there. These cases bring our total number of confirmed cases to 1,192, which is the number that gets reported to the World Health Organization. There are 3 cases considered to have recovered from COVID-19, which means our total number of active cases is 23. There is no one in New Zealand receiving hospital-level care as a result of COVID-19. Yesterday, the labs completed 2,575 tests. That brings the total number of tests completed to date to 424,719. And I am advised and reassured that these numbers will continue to increase over coming days. I'd like to make a few words on managed isolation absconders. There's been interest in the contact tracing and health advice around the 2 absconders from managed isolation facilities in Auckland and in Hamilton. In these situations, health officials, along with the New Zealand Police, undertake investigations surrounding the incident by interviewing the people and using mechanisms such as CCTV footage, cell phone movements and bank transactions in order to get as clear a picture as possible of the events. Alongside this, health officials will also be in contact with businesses where these people may have visited. In the instance in Auckland, I'm aware that communications did occur between the supermarket and health officials the morning following the incident, with police having had contact during the evening of the incident. However, I have asked officials to ensure that they tighten up that process around providing advice to businesses in these situations, including the advice they provide to staff. In relation to the health supports available to people in these facilities, there's a reminder that all people that enter managed isolation receive a health assessment on arrival, which covers both physical and mental well-being. Some people do require more health support, which is provided on a case-by-case basis as required. In relation to the incident in Hamilton, Air Commodore Webb gave details about that in his statement this morning, and I've been advised by the local medical officer of health that a second test from the swab taken this morning has also been found to be negative. I've also been informed that there were no other customers in the store when the person was there based on the CCTV footage. The Auckland experience highlighted that we needed to tighten up our responses to these situations, and I think the response in Hamilton shows that we have done that. And I do want to particularly thank Countdown and the liquor store owner in Hamilton for their responsiveness and their responsible response in this situation. Their actions have helped us to ensure that our team of 5 million will remain protected from COVID-19. A brief word on digital diaries. Having no cases of COVID-19 in the community does not mean that we can be complacent. We need everybody to be keeping a record of their movements. Downloading the COVID Tracer app and scanning codes is an easy way of keeping a secure record of your movements. The Ministry of Health is continuing to develop new features for future updates that will support contact tracing in response to feedback from New Zealanders. For example, one of the things that we know Kiwis want to be able to do is record visits to friends and whānau, and so there needs to be functionality to manually enter information like this where no QR code scanning is possible. We also need to support some older models of cell phones. Both of these issues will be addressed in the next update of the COVID Tracer app, which will be released by the end of this month. The Tracer app has now recorded 592,700 registrations. There are 77,459 posters with QR codes that have been printed, and 1,387,308 poster scans have taken place. The next update on those figures will be provided on Monday, the 13th of July.